Hello guys, so you're welcome to our channel All Around Health Talk, and like we said last week, today we'll be teaching you how to measure your blood sugar level. Here we have all our equipment ready to measure the blood sugar level. Today we're going to be using antibacterial to make sure that our hands are clean for this procedure, but on a normal day in a hospital setting I would need to wear gloves for this procedure. But since we're not in a hospital setting and we do not have gloves here, we've decided to use the antibacterial, which is also to make sure that our hands are clean. We have our wool here, and here we have the glucometer, which is actually what records your blood sugar. Here we have the Lancet device, which is supposed to hold the Lancet. The Lancet is like a needle that you use to prick the patient's finger for you to get the blood. And here we have the strip, which we have to insert into the glucometer for us to be able to read your blood sugar level. So these are all the things we need, and of course we need the patient and we need the doctor or whoever is going to be measuring the blood sugar level. So first of all, what do we have to do? First of all, we'll need to make sure that our hands are clean. You could use alcohol for the patients, but in this case we would use the same antibacterial to make sure that our patients' hands are clean. So okay, so now once we have our hands clean, we move forward. First of all, we need to make sure that the Lancet device has the Lancet in it. Okay, so as usual, it's important for us to make sure that we explain to our patient what we're about to do and make sure that we have their consent. In this case, this patient knows what she's about to do and we have her consent because she's a doctor too, so she knows what she's about to do. So anyway, first of all, we have to open the Lancet device here, and then we pick the Lancet itself. Now the Lancet has a cap, right, which is supposed to protect the needle and protect every other person from being pierced by the needle. So what we do is that we fix it into the Lancet device. Okay. Now once we fix it into the Lancet device, we can now remove the cap, and then we cover the Lancet device. Now, what else do we have to do? We need to make sure that we have our strip, the test strip, and then we open and we take out the test strip. Now, what do we do? Now, the test strip has two ends, yes? One end has black and white lines. Now, this is the end that goes into the glucometer, and the other end is the part that collects the blood from the patient's finger. We're going to be inserting the test strip into the glucometer, and once you insert it, the glucometer automatically comes on. Now what we have to do is make sure that we have the patient's finger ready. Now you can use any of the fingers. You could pierce the patient here, by the side, or in front, or at the top, but piercing at the side is less painful, so we want to cause as little pain as possible for the patient. Now what do? We have to set the Lancet to 8 or 7 here, and then we pull this, and for us to prick the patient, we need to press this so that the needle comes out and goes into the skin. Okay, so we puncture, and then here we have the patient has been punctured, so now we have to squeeze so we can see the blood. So here our test strip is ready, and we want to pass in the blood into the test strip. We need to get enough blood so that the test strip can read. Now we wait some few seconds and we'll be seeing the value. So this patient here has 74 milligram per deciliter, which is her blood sugar level for now. Okay, normally this patient should have between 70 to 110 milligram per deciliter, which is the normal, and so we can see that this patient has the normal range of the blood sugar level. Now with this done, we already have this, so we need to make sure that we want to compress this so that this patient doesn't bleed too much. Okay, so now we have to safely remove the test strip, okay, and also make sure that we safely remove the needle or the lancet from the device. So once we open the Lancet device, we want to cover back the needle before pulling it out, just to be on the safe side. Then we make sure that we close this back and we keep here securely. Now, so it is important for us to properly dispose the lancet and the test strip. We need to remember that the test strip has blood and the lancet has punctured a person's finger, so it's really not safe for us to dispose it anyhow. So if we were in a hospital, we would have special places for disposing this. But if you're taking this measurement at home, please try to look for a good place to dispose of it. Also, you could also burn the test strip and the lancet, just to avoid kids from touching and getting injured. Okay, so yeah, this is how you measure your blood sugar level.
Okay, so that's what we have for you guys today. I hope you guys learned as usual from all this, and I hope that it is beneficial to you all. So our next topic is going to be about vaginal infections, because that's actually something that is very, very frequent in our community and society at large. So tune into our channel next week to watch out for that video. Don't forget to like, comment, subscribe, and of course share to everyone you know, your friends, your families, all the people around you, so that they could also benefit from these videos. So see you guys next week. Bye.